All right, so I'm here with Joseph. And Joseph, can you tell me what it was that brought you here to the clinic for the first time?
I shoulder pain mostly.
And how'd you hurt it?
And I heard it in a combat related incident in 2005 originally. And I
Okay.
had hurt both shoulders, and over the years, uh, I've had MRIs on them. I had low grade rotator cuff tears
Mm-hmm.
in both shoulders.
Mm-hmm.
And I'd done different multiple rounds of physical therapy, and largely my left shoulder had become where it wasn't a problem, but through a lot of different rounds of physical therapy, and the most recent one being about 18 months, my right shoulder had just still had a lot of problems.
And what kind of things had you done for the shoulder in the past? You done physical therapy, anything else?
I had physical therapy. I had the it's a
So the
like
cortisone
a
shots?
yeah cortisone, the crystal,
Yeah.
like 6 month extended release painkiller shots in it, and mostly I think it was just the physical therapy, and that I'd worked with a sports medicine
Mm-hmm.
finally like for 6 months,
Mm-hmm.
and they looked at doing surgery, and we were trying to get away from doing surgery,
Mm-hmm.
and so they did a different type of physical therapy than I'd done with it in the past,
Mm-hmm.
and so it used a lot of like with the suction
Oh, good.
and the what is it called, the Gralston.
The
uh,
grassing.
yeah, that
Sounds painful.
painful, but I mean, it helped a lot. It got things a lot better, but it was never back to 100%. It was constantly painful,
Okay.
and
So we're talking years and years and years, constant pain in your shoulder. Got some significant, but not anywhere near total improvement.
right.
Now, what did we do to you?
So we did we did the Prolozone shots,
Yeah.
and then just some. It's like a what a sugar saline solution
Yeah. That's it.
shots
Yeah.
around the affected area in my shoulder.
And what happened with that?
Well, within the first couple rounds of shots, I think it was just one round of Prolozone, and then maybe one round of just the
Mm-hmm.
saline sugar solution. I went from I went down to run a physical fitness test for the Marine Corps,
Mm-hmm.
and previously, because of the pain in my shoulder, it would be grinding and start popping. I could do about 5 pull-ups before it got too painful,
Mm-hmm.
and it wasn't for strength. It was the pain was too much
Right.
when I did pull-ups, and I went down to do my physical fitness test, and I got 14 pull-ups, and I never had any pain in it.
And that was within just a week or so of doing the second one.
Yes,
And the second was only a few days after the first one.
right.
So this was remarkably better. Since then, how have
Way
things
better.
been?
Since then, I think I've had 1 or 2 other rounds of shots. I can't remember if I had more Prolozone or if it was just the sugar saline
I don't
solution.
remember either.
But I had those within a few weeks, and then I went to Quantico, Virginia for an advanced gunnery sergeant school, and it was very physical intense.
Yeah.
I never had any issues with my shoulder.
Wow.
And then recently, within the last month and a half, I started helping out some family members who own a construction company, and they were in a tight spot where they had way too much work and not enough employees.
Mhm.
So I went back to work for them to help them out, working 12 to 14 hours a day doing construction, very manual labor, and I hadn't had any issues with
Nothing.
my shoulder.
So what could you do afterwards that you couldn't do before?
Mostly anything above the plane of 90 degrees. So
Yeah.
getting my arm up, doing like cross rotations
Yeah.
with my arm above 90 degrees. Anything either above 90 degrees or also reaching behind.
Yeah.
And where it would be intensely painful before, and sometimes it would kind of the tendon would bind up and then pop, and there'd be a loud audible pop, and it was so painful I'd hit the ground.
Wow.
I couldn't throw a ball. Like I'd have to throw things underhanded to play fetch with my dogs or whatever. I couldn't throw anything overhanded, or it would hurt really bad. And I could do all that stuff now.
Now, is there anything that you want to share with somebody who might be watching this?
I think this is a tremendous. If you've done physical therapy or whatever stuff, and you have shoulder or joint issues, and they're talking about surgery, I would definitely look into this treatment before you go to surgery, because it's It's very, very relatively easy and takes a couple of weeks, and you should be seeing
improvement already.
Major improvement.
Do you mind if we put this on a website or the internet or advertising stuff? Is that okay with you?
Yeah, absolutely.
Thank you so much.
Yep.